Thanks so much. Good evening, and just wanted to share a word of gratitude to the SAGES Global Affairs Committee, as well as SAGES Education Committee for allowing me the opportunity to join you today virtually from Memphis, Tennessee. I'll be talking today about the Association of Academic Global Surgery, which is a novel organization, and how to involve your program in global surgical education. I have no disclosures. And today we'll talk a little bit about the definition of academic global surgery, get into the why behind the Association of Academic Global Surgery and what it intends to accomplish and with whom, and how and where to get started with your global surgery work, whether it be at the level of a program or as an individual, and where we are headed as the Association of Academic Global Surgery. First off, the definition. Academic global surgery involves the application of research, education, and evidence-based advocacy towards surgical healthcare in regions with health inequities. We arrived at this definition through much discussion, some publications, and really great global surgical leadership. Some of those leaders actually helped form the initial advisory board for AAGS. With this definition, they started to have some discussions. Much of what we had seen since the publishing of the Lancet article in 2015, I have here shown the disease control priorities document. There's been a significant growth of new programs as well as further development of blossoming of existing academic global surgery programs. And what became evident was that there was a natural knowledge and experience gap between the long-established global health and surgery programs and those newly formed programs that really came up since the 2015 publication. For that reason, as our global surgery leaders came together to think about the possibilities and need for more community around academic global surgery, AAGS was conceived, this as an idea. And the actual formation of AAGS was intended to help support the growth and expansion of academic global surgery. Those four individuals that I referenced are Dr. Gurma Tafira from Operation Giving Back and the American College of Surgeons, Dr. Raymond Price, Dr. Mamta Swaroop, and Dr. Sanjay Krishnaswamy. These four folks are responsible for really spurring the beginning of the Association of Academic Global Surgery and really formulating a concept that was enacted, such that in 2017, they gathered a large group of individuals, about 200 folks in a conference room, hosted by the Operation Giving Back at the Clinical Congress for ACS. And during that time, helped the crowd think about what might be needed in order to move forward in terms of structure, constitutional components, and initial committee needs. And out of that conversation really formed the committee that I was involved in, which was the Rules and Regulations Committee. I was, my team, I was with Dr. Chris Dodgen and Dr. Marianne Hopkins, and the three of us worked with the entire group on formulating a draft constitution as well as draft leadership structure. We were thus incorporated into the advisory board, as well as Dr. Ziad Sifri, shortly after ratification of the Constitution. And similarly, Dr. Katayun Madani and Dr. Miriam Saeed joined in the last year as well. Our vision is to envision a world where safe, effective, timely, and affordable surgical healthcare is accessible to everybody. We aim to establish academic approaches in global surgery in order to reduce surgical healthcare inequity worldwide. We will engage and unify academic global surgery in order to accomplish the following: cultivate and refine the teaching and administration of global surgery programs. We'll do that through collaborations and partnerships globally. Support global surgery programs in developing equitable bidirectional collaborations. And last but not least, develop the next generation of compassionate, capable academic global leaders in surgical education, clinical care, research, policy, and advocacy. Who is AAGS? So when we opened up the membership just a little bit over a year ago, it was quite exciting to see where everyone came from. Naturally, the vast majority of our members were active members. And over the past year, we've accumulated a total of 415 members, 196 of them active members. And we'll go over the memberships here in just a little bit. 130 associates, and 89 students. They're from all over the world. The vast majority certainly are from the United States, but also represent all of the countries listed here. These folks come from all of these institutions. This is a very busy slide, but wanted you all to see the institutions and organizations from which they come, and they're coming from all over the world, which is wonderful. The membership categories, as I referenced earlier, are fairly simple. The active membership is for individuals who are active in global surgery and carry some sort of certification, whether it is board certification, similar to here in the United States, or a similar credentialing process in their country of origin. Associates include our fellows and residents who are in training and have yet to finish their boards or certification. Emeritus are folks that elect into this category, which is non-voting, and they can also retire into that status. Students are welcome as well and an important component of our membership. And affiliate is a membership category that allows for our colleagues in anesthesia, nursing, social work, pharmacy, folks who are active in global surgical work but don't fit into the other membership categories. The structure of the association is actually fairly simple. On the right here is our leadership council, which is our elected officer positions. And these folks are responsible for running the organization from a business standpoint of making things happen and keeping it alive. With regards to the work and the development of ideas and direction, these happen at both the committee level as well as the Institutional Representatives Council. So the committee level, I'll show the committees that we have so far. They develop and deploy the work of AAGS, while an organization called the Institutional Representatives Council really provides both a platform and a voice for our institutions that are represented among our membership to really be able to understand how policies that the committees might develop, for example, around accreditation or research or other similar kind of standards, how they might affect global surgery programs at the institutional broader level. And of course, the individual members are at its core who AAGS serves, all with the support of our Leadership Council. This is an example of the Institutional Representative Council. Certainly, these are not all the universities represented, as you saw from before, but each institution has the opportunity to select 2 institutional representatives, regardless of the size of the program or the institution. This allows for equitable voice across the board. And this council is responsible for helping to prioritize the tasks in order to support global surgery program development and also facilitate collaboration between institutions. They do have an opportunity to elect chairs and vice chair to the Leadership Council as well. So how and where do you begin with your own program? Well, in terms of what each individual brings to the table in an organization like AAGS, the most valuable thing that we bring is our relationships. And so one of the most wonderful opportunities in this type of work is to take a look at our own relationships that we have at our institutions, whether they are housed within the Department of Pediatric Surgery in a group that has a long-term relationship with Honduran surgeons, or a group out of thoracic surgery that has a long-running working relationship with a group of surgeons in Eastern Europe. This allows for us to have a listening opportunity to listen for opportunities that might come about around common problems or common unmet needs. And of course, an opportunity to co-develop solutions to those problems. And as we develop these solutions, when in doubt, certainly tilting the scales in favor of our LMIC partners is always the recommendation. These are the committees that are currently within AAGS. And to give you an example of the weight and the import of the work that each of these groups are doing, for example, the Education Committee is developing a core curriculum for academic global surgery, as well as a more advanced and comprehensive curriculum for what might be considered for a global surgery fellowship. Similarly, the research committee is developing research guidelines around academic global surgical research, while an ethics committee is developing a code of conduct and framework for academic global surgical work, both clinical and research. In sum, the formation of the Association of Academic Global Surgery offers all of us an opportunity to cultivate and empower existing relationships. It also offers us an opportunity to have new pathways to partnership and collaboration. As you can see, there's an incredible amount of important committee work being done and more to be done. And so we encourage all of our members to join committees and be active, as this is very, very early and young organization. We will very soon have an opportunity to elect our first executive leadership positions for the leadership of AAGS. And of course, our AAGS membership is always being built, and we're always soliciting new members. So recommend and suggest that you all spread the news to your learners, your colleagues, and your partners, that they're all welcome to join us. And if there should be any need for further information, you can tweet to us at AA Global Surgery. Write to us at our Gmail address is listed here. Our website is listed as well, and that's where our membership application is. And lastly, you can also email me directly as well at my uthsc.edu address. Thanks so much for the opportunity to be with you all this evening virtually. Take care.